Greeting viewers. Signs your blood sugar is too high. Sugar, or glucose, is found naturally in the blood of humans. The proper quantity of blood sugar provides energy to the body's cells and organs. Hyperglycemia is the medical term for having too much blood sugar. Some blood sugar is produced by the liver and muscles, but the majority comes from carbohydrate-rich foods and beverages. The body requires insulin to keep blood sugar levels within a reasonable range. Insulin is a hormone that tells the cells in the body to take in and store glucose. Blood sugar levels rise if there isn't enough insulin or if the insulin isn't working correctly. High blood sugar levels can be harmful to one's health. What is hyperglycemia? Why does it occur, and how can you tell if your blood sugar levels are too high? Continue watching to find out. 1. Frequent urination. Your kidneys start attempting to pour out more sugar to get rid of it when you have too much sugar in your blood. And when they expel the sugar, they also expel water. This forces you to use the restroom more frequently than normal. 2. You are constantly tired and exhausted. Uncontrolled blood sugar causes fatigue and excessive weariness. Simply said, when your body does not digest insulin effectively or does not have enough insulin, the sugar in our blood stays in our bloodstream rather than being used for energy. Dehydration can also result from frequent urination, according to Bondakwala, which is another factor that contributes to exhaustion. 3. You're hungrier than usual but losing weight. Many people who have uncontrolled high blood sugar become hungrier than normal, a condition known as polyphagia. According to the Mayo Clinic, even if you're eating more, you may be losing weight for no obvious reason if your blood sugar levels are too high. Your body needs to turn to muscle and fat for energy since it isn't getting it from the preferred source, glucose. Unintentional and harmful weight loss occurs when your body begins to break down muscle and fat for energy. You may feel muscular weakness and fall more frequently, in addition to these changes in weight and hunger. 4. You get a lot of headaches and your vision is blurry. You may notice that your vision isn't as sharp as it once was and that things look hazy. Fluid escaping into your eye from high blood sugar levels might cause puffy lenses. This alters the curvature of the lens, making it impossible to focus correctly and resulting in impaired vision. You could also be having trouble at work, having trouble driving, and getting regular headaches. 5. You have sores that take longer to heal than usual. According to the National Institute of Diabetes and Digestive and Kidney Diseases, cuts, scratches, bruises, and other wounds heal more slowly when blood sugar is out of control. Diabetes damages nerves and impairs circulation, particularly in the lower legs and feet, causing wounds to take longer to heal since there isn't enough blood flow to the area. Even minor wounds are more susceptible to infections, which can become quite serious and result in foot amputations. If you develop a foot ulcer, you may notice fluid leaking into your socks or an unpleasant odor, according to the American Podiatric Medical Association. 6. You notice tingling and numbness in your hands or feet. Uncontrolled blood sugar, often known as diabetic neuropathy, can cause nerve damage. In your hands and feet, you may detect a tingling sensation or even numbness. Some folks also suffer from discomfort in their hands and feet. Though neuropathy is more frequent in persons with long-term diabetes, it can affect anybody with poorly managed diabetes. 7. Blisters, dryness, or other skin changes have appeared. Skin tags are little bits of excess skin that grow in the creases of the skin, especially if you have diabetes, and are attempting to lose weight, according to the American Diabetes Association. Acanthosis nigricans is a dark, thickened region of soft skin that can appear on the back of the neck, hands, armpits, face, or other locations. Insulin resistance can be detected by these symptoms. Blisters, infections, dryness, itching, discolorations, and other skin anomalies can all be indications of high blood sugar. If these skin changes persist, see your doctor. 8. You're getting yeast infections more often than usual. Hyperglycemia can increase the frequency of vaginal yeast infections. According to the ADA, Candida albicans is a form of yeast, a fungus, that is commonly the reason. The symptoms in females might include vaginal itching, redness, or soreness, pain during sexual intercourse, pain or discomfort during urination, and thick, atypical vaginal discharge, according to the Centers for Disease Control and Prevention. While yeast infections are frequent in individuals without diabetes, having more glucose in your blood increases your chances of acquiring one. The yeast feeds on glucose, and if your blood sugar is high, your urinary tract has more glucose. Men who are not circumcised and have hyperglycemia are also in danger. We're seeing this a little more now with people on SGLT2 inhibitors, which push the body to excrete more glucose through the urine. The FDA has added a warning concerning a considerably more uncommon, and possibly fatal, genital ailment known as necrotizing fasciitis of the perineum, or Fournier's gangrene, to the prescription instructions for SGLT2 inhibitors, commonly known as flesh-eating disease. 9. Swollen or bleeding gums, which increase your infection risk. According to the National Institute of Diabetes and Digestive and Kidney Disease, gum disease is a consequence of diabetes. According to the ADA, the body's response to illness is to release more glucose into the circulation, making diabetes more difficult to manage. Your saliva includes glucose, and the more of it there is, the more germs there are to feed the bacteria in your mouth that mix with food to produce plaque and cause gum disease. Initially, red or irritated gums may be seen. If left untreated, they can lead to periodontitis, which causes your gums to peel away from your teeth, pus or ulcers to form, and even tooth loss. To avoid damage to your gums and teeth, get your blood sugar under control and consult a dentist. 10. Dental issues. Glucose may be found in both your saliva and your blood. When you have too much of it, it promotes the growth of dangerous bacteria in your mouth, which then combines with food particles to form plaque. Tooth decay, cavities, gingivitis, gum disease, and poor breath are all symptoms of this. One of the first signs to watch for is swollen, painful, and bleeding gums. When should you see a doctor? If you're having one or more of these symptoms to the point that they're bothering you or affecting your life, for example, you're too exhausted to get through the day, it's time to see a doctor about your worries. A specialist, such as a primary care physician, can help you figure out if your symptoms are caused by high blood sugar related to diabetes or prediabetes. Even if you're not sure that's the case, it's important talking to your doctor about hyperglycemia and other potential reasons for your symptoms. Thank you for viewing this video. If you notice any other signs of high blood sugar, please let us know in the comments section below. If you liked the video, give it a thumbs up and share it with your friends. For more secrets and tips, subscribe to the channel. There are 2 more videos you should see, both of them will undoubtedly assist you to achieve your goals. See you in our next video.